every single day in practice, and that is, how do I look like the best version of myself? And really, it's a question about the long game. And I talk about this all day long. You're doing the toxin to relax the muscle, you're doing the filler to add volume if needed, and you're doing your skincare products. You're doing all the right things. But at some point in time, you have to stimulate collagen, because we know after the age of 22, you lose 1% of collagen every year. So it compounds. And sometimes you start seeing it in your 30s, like around the eyes. Sometimes you see it in your 40s and 50s along the jawline. So we want to talk about the long game and how 3 different devices can actually improve the collagen to restructure and rebuild that collagen. BBL, MOXI, and UltraClear. There is no single right answer. It all depends on your schedule and where you start. Because if you don't have a lot of downtime, we're going to go one direction. If you really want to hit it hard, we're going to go in a different direction. So tonight, Courtney, Addie, and Amy are going to go over these 3 modalities and how they can help you win the long game. So I'm going to hand it over to Amy. Amy performs BBL and MOXI in our practice, and she's going to talk about how it can work.
Patients in my treatment room are things like uneven pigment, texture, pores, fine lines, and just overall skin health. So if you're wanting to address those issues, treatments like BBL and MOXI will help with that. BBL and MOXI can address all of these concerns by using energy that is delivered into the skin, and it triggers a biological response to help with things like texture, pores, fine lines, hyperpigmentation, and overall skin health. Based treatment that targets the reds and the browns in your skin. So if you have sun damage, hyperpigmentation, you're suffering from just diffuse redness, or you get like a rosacea flare up, or even broken capillaries, this is where BBL comes in to target all of those things. So it uses a light energy to target the melanin and the red in your skin to address all of those issues. About 2 weeks after your BBL treatment, once your skin is completely healed, you'll expect more clarity to your skin. You will notice a difference in the redness and broken capillaries, and just a lightening of any pigment that you may have had prior to your BBL treatment. You may even notice that you're wearing less makeup, and you can just throw on your Color Science tinted sunscreens in your skin. We also have MOXI, which is our non-ablative fractionated laser. And what that means is it doesn't actually vaporize the top layer of skin like our UltraClear laser does. So the downtime is a little bit easier and the recovery is much shorter. MOXI is great for those patients who have texture issues. Maybe you have pores that you want to address, or even melasma. It's a great treatment also just to give your skin a really beautiful polished finish. And we love MOXI because it can be done year round. It's a treatment that's safe to do all year, even in the summertime. After your MOXI treatment, your skin goes through a process called MINS, and that stands for microscopic epidermal necrotic debris. That just means that old skin is working its way from the bottom up to the surface. It creates like a bronze speckled appearance to your skin, and you'll develop a sandpapery texture that lasts about 5 to 7 days. Each day as you wash your face, that texture will get softer and softer. And by the time you hit day 5 to 7, you're just going to have a really pretty glow to your skin. Once your skin has healed from your MOXI treatment, after about 2 to 4 weeks, you will notice a really pretty glow to your skin. You might notice a lightening of surface pigment or melasma, but we call this the no filter treatment because it just gives your skin such a pretty polished finish to it. If you're wanting to address multiple concerns like the brown pigment, the texture, the pores, and broken capillaries, we can actually do BBL and MOXI in the same session. This is honestly my favorite combination treatment, just to target everything all at once. It makes the downtime easier whenever you do them together because you're not going through the downtime of the BBL and then the downtime of the MOXI, and they work synergistically to give you just a beautiful result at the end. While BBL and MOXI are great options for a lot of patients, if you're someone who is looking for a deeper correction, then UltraClear might be the answer for you. If you're okay with that bigger downtime, then listen up because Addie's going to tell us all about it next.
It is for people that have advanced skin concerns, whether that be significant sun damage, moderate to severe acne scarring, rough skin texture, those deep set lines, or even skin laxity. Now, I'm going to be completely honest, this is not for everyone. That's why it's so important to have a consultation so we can go over everything at that time and make sure that this is the right fit for you. With UltraClear Laser, we are creating controlled injuries into the skin. That triggers our body's natural wound healing response, which stimulates collagen production and elastin production. So essentially, we are taking out the old and laying down new. This is not only polishing the surface, but it's giving us that structural change. The most common question I get about UltraClear is about the recovery time. And it can be daunting. I'm not going to lie about that. But we would love to go step by step and show you what a true recovery looks like. So our founder, Haley, she gets this treatment done every year. And she pencils this in because she believes that the downtime is worth the result. So I'm going to hand you over to Courtney so she can take you step by step on this recovery.
When discussing light and laser treatments is what does the recovery process look like? This is a very valid concern because with some of our more aggressive treatments like UltraClear, the recovery process can be intense. I want to walk you through an UltraClear recovery process because this is going to be our most intense and aggressive option. So it comes with the most downtime. The day of treatment, you are going to look like you've had something done. You will leave the office with pinpoint bleeding and redness over the entire surface area that's been treated. I think the most difficult process in the recovery timeline is the night after your treatment. So this is when that throbbing, swelling sensation kicks in. You will also experience oozing and drainage from the area that has been treated. It can sometimes be a little bit difficult to sleep that first night just because of that uncomfortable feeling. I think once you get past that first night, then you start to feel a lot better. Day 1 through 3 after the UltraClear treatment is going to be the most intense of the recovery process. Pain-wise, nothing's really uncomfortable, but it's more so just what you look like. This is really when your swelling is at its peak and your skin is going to be the most red and sensitive. This is when patients typically don't want to leave their house. They look like they've had a very aggressive laser treatment done, and they aren't really able to put anything on top besides the topical products we recommend for healing. So we advise no makeup or even sunscreen during this time. Day 3 is when a lot of our patients typically see that turnaround with their swelling and the redness. Now, by no means are you going to look healed at this point, but it is a significant reduction in the swelling and the redness that you'll see. So day 3 through 5 is when, again, you're going to notice a little bit less swelling, maybe a little bit less redness. And this is when you'll start to see some of that skin essentially sloughing off the face. It sounds scary, but it's actually very satisfying because you're getting to see that new pink skin that's laying underneath. Day 5 through 10, most of the swelling is gone at this point, and you're just left over with that erythema or light redness to the face. This is when a lot of our patients are really starting to get excited because they can see this new bright skin coming out from underneath, but you're still going to have that pink undertone. Day 10 through 14 is where a lot of our patients feel presentable at this point. Yes, you're still going to have some very mild pink to red undertones to your skin, but you're able to put on a tinted sunscreen and go about your normal activities at this point. So when is your final UltraClear results? This is going to be 3 to 4 months after your laser treatment. This is when we can really see in those before and after photos that nice, healthy glow, that stimulation of the collagen and elastin that's now giving your face more structure, less texture. So about 3 to 4 months from your treatment is really when you see the best benefit. So as we've discussed with our recovery timelines, UltraClear is going to be the most intense recovery. Typically 2 to 3 weeks is what I tell my patients to plan on. Next is going to be your MOXI. Usually after day 3, you feel like you're back to your baseline. And the least amount of recovery is going to be with the BBL. Usually after 24 to 48 hours, you feel like the redness and the swelling is completely gone. After each procedure, you will be given a very detailed guideline of what to follow in terms of skincare products. After UltraClear, we will actually give you the products that we want you to use. But the most important thing is avoiding the sun and avoiding any heat. So things like saunas or just laying out at the pool after any of these types of procedures. In order to see significant changes in the skin, we have to do something to disrupt the barrier, and that comes with some downtime. But Haley's going to talk about her
question, and that is, how do you look like the best version of yourself? And the girls have talked about BBL, MOXI, and UltraClear. I've had them all done, and I will continue to have them all done because I know that it helps in the long game. If I want something that's not going to have as much downtime, I go the BBL MOXI route. If I really have the downtime of a full week, 5 to 7 days, I'm going to go UltraClear because I know the stronger the wound, the stronger the result. So this all depends on what you need. Let us guide you through that process of deciding like what you want to achieve and how much downtime you have. Then we can put this perfect plan in place. Starting right now, all the services are 20% off. If you don't know which one that you want to have done, that is okay. You have 6 months to have these procedures done. It's just making a commitment now for the long game. Thank you so much for being with us tonight. We hope we've answered all your questions, but if we haven't, stick around for the live Q&A. Well, good. Are we on?
We are.
Okay. Good evening, everyone. Thanks for staying for the live webinar. We've done a few of these, and we're really just here to kind of help answer your questions after hours, or if you can't get in for a consultation with us, we want to be able to help answer these questions and help you make the right choices for the procedures that we have on sale. So we have one question. We'll go ahead and start with that. And it says, can you opt to do an UltraClear in a specific facial area where laxity is most obvious, or do you need to do the full entire face? It's a great question. And I would tell you, you can do isolated areas. So I could do Amy's eyes, or I could do around her mouth area. But if you have significant sun damage, you definitely want to do the full face treatment first, then go back around and do those specific areas, because UltraClear does a really great job on reducing sun damage and helping with the pores. So you don't want to have a really great, result only in the areas we treat. But there's a lot of patients that we will do full face, even full face and neck, and then we'll go back around eyes for isolated treatment. So for example, when I had my treatment last February, we did full face, and then we actually went back and did my eyes a little bit stronger in the same session, but we did really strong eyes, as opposed to the first session I had done where I just did the same treatment all over the face.
I would say if you're going to have that big downtime anyways, if you're doing just around the eyes or just around the mouth, you might as well just go ahead and do the whole face and just get that skin rejuvenation everywhere, because you're going to be down either way with the same amount of downtime. So,
And I think eyes are actually one of those areas where you may want to do twice, because it's usually the lower lid laxity that people are really, especially when they smile, those lines right there, that's what gets them the most. So that's where I would do a targeted second treatment.
I can't see.
Are those treatments good for all skin types? So for UltraClear, you can do all skin types.
Yeah.
And so it is color blind to a certain extent. We just have to dial up or dial down the heat. But we can do any skin type. Now, there may be some skin types we want to precondition with skin lighteners beforehand. But even with UltraClear and MOXI, you still can't come in tanned. So that's something that we need to look at before you have either treatment.
Yeah, MOXI, like we talked about in the video, you could do it any time of year. We can do it on any Fitzpatrick. Like she said, if you do have a lot of sun damage or tan on your skin, we may want to let some of that tan settle, or even put you on something like Triluma or some kind of skin lightener prior to the treatment. Now with BBL, it does specifically target melanin or pigment. So I want you to have as little color on your skin as possible when we do that treatment. So that means if you're going on a beach trip, you're going to the lake, anything like that, we would want to probably push your treatment out at least 2 to 4 weeks, depending on your skin color and your skin tone, and then maybe get you on a skin lightener like Triluma, Kojupad, something like that prior to your treatment.
So how do you feel about spot treatments of BBL? So let's say I had a really big spot right here or a spot right here, but I had sun damage, but I had 2 big spots that bothered me. How do you feel about spot treatments?
I've had a lot of success doing spot treatment. So if you wanted to come in for a spot treatment session, it's a 15-minute session, and I can accomplish a lot with just spot treatments. I still want you to have as little color on your skin as possible, but if you have a little bit of a tan and we want to hit just a few specific brown spots, I'm happy to do that. Even with broken capillaries. So if you have broken blood vessels around here, but maybe you don't have a lot of brown spots or pigment that you want to address, we can go in and target that pretty quickly. So yeah.
What areas of the body can you treat? So we actually did a split chest last year, or was it earlier this year or last year? I can't remember. We did a split chest, and on one side we did the UltraClear, and on the other side we did BBL MOXI. Yeah. And I can just tell you that all day long I would do BBL MOXI on the chest. Now neck, I like UltraClear because it's much more aggressive on neck, and you get more of a tightening appearance on the neck. But when it comes to chest, the skin is just so much different. It was itching and it was driving me crazy. Yeah. And for the result, BBL MOXI all day.
Yeah, for sure.
Yeah.
Someone did ask on there if you could do saggy skin on the neck with UltraClear, and absolutely you can do that.
I like UltraClear for neck, but it just heals a lot slower. I'm just going to be really honest with you. And if anyone has itching, it's usually on the neck because it takes longer to heal. So if it's 5 days or 7 days, 5 to 7 days on the face, it's a good 10 to 14 days, if not longer, on the neck. And so it's aquaphor longer, it's taking care of a wound longer. But I'll tell you, like the patients who come in who've had their necks, I've gone aggressive with them. And I will say the pain on that patient would probably be like around a 7 out of 10. So it's a little bit more significant. And we do have a new option now for an oral medication to help with pain. We'll do a loading dose with it, and it's really supposed to help, significantly with the discomfort. So that's what I would use on necks for sure. And we can even use it on faces if you just don't like any pain whatsoever. But the necks just take a little bit longer. So, but the necks, when that patient came in, I'm like, you have the neck of a 20-year-old. Like, I'm not lying. Like, it was really, really great. So it wasn't tight like a neck lift or a facelift, but her skin just looked a lot better on the neck area.
Yeah. And then one of the treatments that we did not talk about on the previous video is Sofwave.
Yeah.
Sofwave is also a great treatment for laxity on the jawline and the neck. If you have more severe skin laxity, I would probably send you to one of our nurse practitioners to talk about UltraClear. But Sofwave is a great no downtime option. Usually when I do Sofwave, I will treat from the collarbone all the way up to the brows.
Yeah.
So you're going to notice a lifting in the brow, maybe like a pull back here. So like a little, almost sometimes looks like you've had cheek filler done because it pulls back here, the jawline, and then also the neck. Sofwave can also be done on the arms, the stomach, and above the knees too.
So that last picture you saw of me, like when Courtney was talking about what's the 3-month, what do you look like 3 months? That was 3 months after the combination of UltraClear and the combination of Sofwave. Yeah. So all of that is totality, because I call those like wounding therapies. So you want your wounding therapies to have a good 12 weeks, 3 months to stimulate the collagen, restructure the collagen so that final result is there at 3 months. So having it done like 2 weeks beforehand, your skin will look fine, but it's not going to have that full result with it.
Yeah. Someone asked if we had to pick one of these treatments to do, or if they've never had one of these treatments done, which one should they start with? I would say that depends on what your goal is, but if you've never had a laser, sometimes we'll recommend you to start with BBL MOXI just because it's easier, it's a safer treatment, the downtime is a lot easier. And if you wanted to start with just one and see how you like it, see the result you get from it, you can always do that. You don't have to necessarily just dive right into the series of 3, but I will say that after people do one, they usually will finish out that series of 3. Doing them consecutively about 4 to 6 weeks apart does give you a really beautiful result.
I totally agree. Like if you never had a laser, I would not start with UltraClear, because I mean, it's like get it out of the way, it's your one and done, but it's just like you're taking care of a wound. And so if you've never had a laser, it's going to be very rare that I just start with UltraClear. I want you to have at least one MOXI BBL, know what you're in for, know what a laser like downtime is. And if you can handle that, we're good to go. But I would not start you out on UltraClear.
Sofwave, totally fine. There's zero skin prep, zero downtime, any time of year, any skin color. That one, I feel like anybody could jump right in and do without, ever doing a laser before.
Yeah. Question on nasolabial fold filler, and I guess the question might be in relation to if you've had filler in this area, then you get a laser, are you okay? I would say, was that the question?
They just want to know your thoughts on nasolabial fold filler in general.
Well, let's leave that to the end, because I've got a lot of thoughts about nasolabial fold filler, but because this isn't the topic tonight, I'll address that at the very end, but I promise you I will address it.
Yeah. All right, let's see. Can I do BBL and MOXI together? Absolutely. This is one of my favorite combination treatments. It just makes the downtime easier when you do them together, and we're able to address so many issues. So I'm able to target the melanin or the brown in your skin, the broken capillaries if you get flushed with like rosacea type flushing. And then when we do the MOXI, we're targeting a little bit deeper, and we're actually targeting pores, fine lines. If you have melasma, we can target melasma, but that's maybe when we would just do MOXI by itself. But,
yeah. I posted a video yesterday. I think we did on the look, like what's the true difference between a BBL and a MOXI? And we best explain it like your BBL is like a flashlight. Like it's going to cover a broad surface area like a flashlight would, but it's going to look for 2 different colors. It's going to look for the melanin in the brown and the hemoglobin in the red. So, but it has no penetration of the light into the skin. The MOXI is like a 1 laser beam. So think of like a flashlight is your BBL, but the 1 laser beam is your MOXI. So it's like going to aerate this, like aerate grass. Yeah. And so when you see that aeration of grass, those columns is where the target for that laser is water. So when that water heats up in the skin, then it creates an injury, then your skin heals around that column of injury. And when it's like the aeration, like the columns, it's got healthy skin around it. So like Amy said in the video, you heal so much faster because you have healthy skin around it. So that's why the downtime is not nearly as significant with BBL and MOXI, but that's the difference. If you have only color to your skin and it's reds and browns, we'll just do BBL. Yeah. But if you have like texture or even like some fine acne scarring or, just uneven skin surface, then MOXI is a great first, try for a laser. Then you take it up to UltraClear, and UltraClear is going to be for more skin laxity. It's going to be deeper lines. And we can actually core. So the coring is like actually drilling out like microscopic columns in the skin. And when we drill that in, then there's a bigger column, and then the skin heals around, and that's where you get that constriction effect. But that takes a lot longer to heal. So we were talking about coring earlier with a patient. I'm like, you might be red. I mean, you had coring done and I had coring done, and you're going to be red for 10 to 12 weeks. It doesn't mean that you can't put makeup on, but like if I core a vector or I core like around the mouth area, which I do a lot of coring that way. And just so that you know, like we're only coring like 2% of the skin. It's not a lot, but that it's enough to get significant contraction. It just takes longer to heal.
Yeah, I think Haley did right here on me just to kind of grab some of that jowling. And I was definitely red for a couple months after the treatment. I could cover it up with my tinted sunscreen and makeup, but definitely expect that. And then also sun exposure is very important to be limited during that healing process.
Okay.
Someone asked, I'm 27, am I too young to start lasers? Absolutely not, because if you remember the problem, we start to lose collagen, 1% of collagen at the age of 22 every single year. So by 27, you've already lost what? 5% of collagen? We're not mathematicians, but you've already lost 5%. So yeah, go ahead and do that laser. Even if you don't have a lot to correct, it's always great for prevention. So much easier to prevent and less expensive to prevent than it is to correct.
Yeah. So there's a couple different ways. I mean, that's why we bought MOXI, honestly, was because it was for younger patients. Now, older, 40s, 50s, 60s also get an amazing result out of MOXI, but MOXI can be like, we can do 3 levels, 1, 2, or 3. You can do a level 1 MOXI and literally not have much downtime at all and be glow ready. And then UltraClear actually has a setting called 3D Miracle. And there's no numbing required. It's got very little downtime, but it's only like 10 microns. So it's very superficial, but it really does kind of help give you more of that glow. You just need more of them. So I say when you're 27, if you've got significant sun damage, go ahead and get started on it, because you don't want that cluster of pigment to get deeper, or like darker and darker, to where it's never going to go away. Because once that cluster of pigment starts, you're always like getting rid of, like it's going to come back and come, we can make it go away, but it's always going to come back if that cluster already exists.
Yeah. Something I also like to mention to my patients is keep in mind, this is never a one and done. So you're not going to do your series of 3 and then just never have to do it again. So this is really a really great opportunity for patients who have already had a series last year to take advantage of doing a maintenance treatment.
Yeah.
And that's why we sell them individually during this special, is so that you can do your maintenance treatment. So I always tell my patients, do at least 1 BBL MOXI something once a year, because there are studies that show that doing 1 BBL a year, it teaches our genes and our cells to think and act younger. So it truly does slow down that aging process and reverse the aging.
Yeah. And it's the one thing you can do, like what time of the year should you have it done? I mean, really, that's why we do this sale now, and we give you 6 months to use the promotion, is because most people are going to start this after Labor Day. Get the lake out of the way, even if fall, most people today have said that they're going to do it after fall break.
Yeah.
And so it's a perfect time to do it.
Let's see, someone asked, can I combine Sofwave with a laser treatment? Yes, you absolutely can. I always will recommend do Sofwave whenever. Your laser, we're going to plan around your sun exposure.
Yeah. Could you do them same day? I mean, you could. It's just a big thermal impact to the skin. So I would give your skin like 2-week break. Like there's no reason to like we don't have a lot of out of towners, but I would at least give it 2 weeks if you could. That way,
It's just a long appointment time
Yeah,
too. So
it is.
Sofwave is an hour and 15-minute appointment for me to
Mhm.
do a full face and neck. And then if you have to put numbing cream on and then do a laser after that, it's just a lot of injury and a lot of sensation in all of one day.
And I've not seen any research to prove that both of them together in the same day actually benefits you. Where we have seen research to show a benefit is the combination of Radius with Sofwave. So we have seen that when you use Sofwave first and get that thermal impact, and then 2 to 6 weeks later add Radius, which is a collagen stimulator, you're going to get 4 to 6 times more elasticity improvement and remodeling. So we like those combinations for not only face, but also like we're doing a few patients right now and doing a study on like above the knees and the stomach area as well.
Yeah.
Let's see here. We got that one.
If I have rosacea, are these safe for me? Yes.
Mhm.
If you have rosacea, BBL is my favorite treatment to calm down the flushing of the skin. It can target that vascularity and just help to kind of shut down those rosacea type symptoms. I'm also able to go in and hit any broken capillaries. A lot of times we start to get them around our nose first. But yes, BBL is a great treatment for rosacea. What about UltraClear?
You can like help with some redness overall, but if I was going reds, because the chromophore and the target is hemoglobin, I would go BBL all day long. I mean, if you had a little, like we had a patient who had Mohs surgery and she had a scar on her forehead. And so I did like I did some like deeper treatments, and then I also went over with that really light, that 3D Miracle, like the 10 micron treatment. And she had a really good improvement of redness. I was actually really surprised. So, but I've also done other patients. I'm thinking about like a scar on someone's forehead recently, and it improved. It just takes a little bit longer to see the result.
BBL?
No, the UltraClear takes
yeah.
a little bit longer with redness.
Yeah, I've also been treating, this patient didn't want downtime, but we've been treating a scar where she fell like right across her forehead with BBL. That's going to take even longer, but we have been able to diminish the redness quite a bit. So
What resurfacing laser treatment is best for someone with minimal downtime? Moxi all day long.
Yeah.
You get that laser treatment, you're going to get the resurfacing, but like talk to Amy or talk to Addie and you can decide if you want a level 1, 2, or 3. And the levels depend on how much coverage you want treated. So what % of skin do you want covered? Each level is going to have more downtime. So if it's a Moxi level 1, you're going to have how much downtime?
I would say just a couple of days, if that. It's very similar to the 3D Miracle. I mean, I always say give yourself the first 24 hours of no makeup, no sunscreen, and no sweating. After that, you can put tinted sunscreen on, you can put makeup on. Very little social downtime.
Level 2?
Level 2, I would say maybe like a day or 2 extra. A level 3, depending on the patient, I would say 5 to 7 days of that same papery texture, but still social downtime is pretty much none for that, other than that first 24 hours. I always say you can put makeup on. It's not going to look its best, but no one's going to look at you and be like, oh my God, like, what did you do? Like, your skin's not going to be falling off. You're not going to have like sloughing of the skin, like throughout the day, nothing like that. So it's very easy.
Does this work well with my toxin, like Botox and filler, or do I need to wait? So I always say, just as a good rule of thumb, wait 2 weeks between treatments. That way one has, the toxin has time to like kick in, do its thing. The filler has time the swelling to go away, the bruising to go away, and to settle into the skin, and then hit it with a laser. You can do Sofwave, anything like the only thing I would say you probably shouldn't do Botox or filler 2 weeks after I say was UltraClear. And the reason why is the skin is what we still call friable. So if I inject a needle through that fresh skin that's still healing, you might get a broken capillary. So if you've ever done like a strong Moxi or a strong UltraClear and you have a pimple pop up and you want to pick that pimple, you're going to get a broken capillary because of the friability of the skin. So I would tell you, Moxi BBL, I think you're fine to do, toxin and filler on, but I would hold out a little bit longer for that UltraClear treatment. Let's see, what options are best for darker skin? You can definitely do UltraClear on all skin types. So you can do from African American, Asian, Indian, all the way to Caucasian. So it's safe for any color type.
Moxi also is safe for any color type.
Yeah. We just definitely want patients who have like Italian or even I've had a patient who had a Moroccan ethnicity, like that they have like a white skin tone, but they tan really, really well. Those are the ones we want to ask you questions on, because we want to quiet and like put a stop sign on those melanocytes who like to get overactive with the heat.
Yeah.
So that's why it's so important, you guys, that we do a consultation to ask you these really important questions.
Yeah.
And the pre-treatment for those types of skin types is going to be anywhere from 2 to 4 to 6 weeks, depending on your skin, like the ethnicity. If you say that, your grandmother, or when you're out in this tan, you're out in the sun, you get really you never burn, you always tan. We're going to have to spend at least 4 weeks quieting down those melanocytes before we activate them with heat.
Yeah, especially if you have a condition like heat-induced melasma. If it's the summertime and you have a melasma flare-up and you're coming in wanting a MOXI to fix it, it's not going to work.
Yeah.
We have to be on those melanin inhibitors to, like she said, quiet down that melanin.
Yeah. So after tonight's event, you will receive a text message and reply with the word "look" to be contacted by our office for a consultation if you really want to sit down and talk to us about the best treatment for you.
Oh, someone asked about pricing. Did you want to go over some of the pricing really quickly?
Yeah. So we're going to read it off right here. Let's just say you're going to do a BBL face just for reds and browns. The regular price is about $495. So if you did, it's about $500. So you're going to take about $100 off of that with this sale price through September 4th. If you're going to do BBL MOXI and face like we talked about tonight,
it's regularly $995. With the sale price, it's going to be $796. So you'll save however much.
$200.
Yeah, $200.
UltraClear is the one that's more pricey. So it's only $3,000 for full face. And if you get into neck, it's going to be around $3,500. But with the sales price, you're going to take $600 off. So it's $2,400 for full face UltraClear. And guys, that comes with UltraClear, it comes with a full set of instructions, and it comes with your skincare after the fact. So you go home with an Elastin skincare kit. It's got your cleanser. And then we're also going to send home micellar water and baby shampoo, because the ointment that you put on, the Aquaphor you put on, the cleansers just don't do a great job of breaking that ointment barrier. So the micellar water and the baby shampoo do a much better job. So you go home with all your products on that as well, and they don't cost extra.
And Sofwave face and neck regularly is $3,000. You'll save $600 on that treatment. It's $2,400 right now. And you can always text into our number 615-814-2150 with any specific treatment that you have questions about, and the girls will text you back with pricing and information on that too. So
yeah, and you also can buy as many of these treatments you want. So if you think, like, we have one patient who's going to be doing her back for her son's wedding, and I know it's probably going to take more than 3 treatments. So if you need to buy 4, you can buy 4 of these if you want to.
Or a combination of treatments. If you want to do BBL MOXI and a Sofwave, or UltraClear and Sofwave, you can buy, whatever you want.
So like in the video you were watching, I had the UltraClear done in February. I think, was it February? I think I had the Sofwave done like January or early February, and then the UltraClear done. And so that was I did January and February for my treatments. And so if you purchase this now, you still can get those done in January and February, which, are colder months. It's just easier to get that stuff done.
Yeah.
You were at the end of February.
Okay. Yeah. Let's see. Any other questions we have here? No? Okay. So again, after tonight's event, you're going to get a text message and just reply with the word "look" if you want our team to call you back tomorrow to schedule a consultation. It doesn't have to be in person. If we want to do a quick FaceTime, we're happy to do that as well. So yeah. And the thing we do ask, if we do a virtual consultation, take your makeup off so we can actually see what's going on in the virtual consultation, because when you have makeup on, it's hard for us to actually see your skin. So if it's not going to be live in person, it come with hair pulled back and clean skin when we do a virtual consultation. All right, guys, have a good night. Thanks for coming.
Good night.